This presentation is about who needs to take thyroid hormone medication and who doesn't need to take it. Because there's a lot of information online really promoting thyroid hormone medication as either something that many people need to do who perhaps really don't need it, or promoting certain types of thyroid hormone medication as some secret that's going to get people well, whereas others don't work.
Absolutely. So the first thing to determine whether or not you do need thyroid hormone is to go to your doctor and have a series of blood tests. The first blood test that should be done is TSH, which stands for thyroid stimulating hormone. Now, the normal range for TSH is not quite the optimum range. So what your optimum range for TSH is between 1.0 to 2.5. Most blood tests will say that you are fine up to 4.5, and they start at ridiculously low, something like 0.5. So you can see that the normal range of 0.45 to 4.5 is quite different than the optimum range of 1.0 to 2.5.
It's important to understand exactly what TSH is. That's thyroid stimulating hormone. And basically, the brain releases thyroid stimulating hormone from the pituitary in order to tell the thyroid to make more thyroid hormone. So if the brain senses that there's too much thyroid hormone in circulation, it's going to lower the amount of TSH. If the brain senses that the body actually needs more thyroid hormone, it's going to raise TSH. So typically, if the brain thinks you need more thyroid hormone, TSH is going to go up. And that's why, typically speaking, or I guess more traditionally, high TSH has signified a need for more thyroid hormone. Although we're going to go later on why sometimes there's a low TSH.
One of the first things is the typical pattern. You have high TSH and you have low thyroid hormone. So that's a simple case. If you give that individual thyroid hormone, they will feel better. But this is where you have an autoimmune illness, which basically means that for whatever reason, the body is basically attacking the thyroid. The body is making antibodies because it feels, for whatever reason, that the thyroid is similar to a foreign body that it needs to attack. In this case, TSH will go up, and the thyroid hormone will stay low, and it will continually go up and up because the thyroid is basically unable to produce thyroid hormone.
Yeah, and if we look at the labs for this pattern, I have here TSH will be greater than 2.5. You don't want to wait till it gets over 4. That's going to make someone really, really sick. You'll typically see T3 and T4 low, although often they're going to be on the low end of reference range, because the reference ranges for both TSH, T3, and T4 are way too big. And the lab that confirms that there is an autoimmune problem are the antibodies. This is thyroid peroxidase antibody and thyroglobulin antibody. It's possible for one or both of those to be elevated. More typically, you'd see thyroid peroxidase antibody elevated, occasionally only thyroglobulin. But both of them should be run in order to confirm that this is autoimmune hypothyroidism.
Absolutely. And it's important when this type of an issue is being treated to not just give thyroid hormone, but to actually address the underlying autoimmune condition. It's much more complicated than just treating someone who has a low thyroid. Most people who have a low thyroid will go on thyroid medication, and nothing is ever done about the autoimmune. So over time, their dose of the thyroid medication goes higher and higher. And even if that's natural thyroid supplements, you still want to address the autoimmune aspect.
Yeah, it's basically what happens in conventional medicine. There's really no interest in why this person has an autoimmune disease. It's just kind of ignored like it's some random accident that just happens. If you can catch it early enough, then it is possible in some cases where you might actually be able to stop it. You can see the antibodies fluctuate. They can go up and down. So it is possible to see the antibodies go down and someone actually being able to avoid having to take thyroid hormone medication. Although it's much easier to do that if this is worked on right away instead of someone waiting 10 years or so in order to try to address the autoimmune disease naturally. However, another problem with autoimmune disease is people can get many different ones. So it's not just the thyroid, like arthritis, for example, that can be an autoimmune disease. But what happens is people will get multiple autoimmune diseases over their lifetime, but in conventional medicine, they're all treated as different problems, when in actuality, there might be some underlying issue that's connecting all of them.
Absolutely. And a good rule of thumb to go by when it comes to autoimmune disease, you never just have one. Any person who comes in to the office, whenever they have one autoimmune disease, it's always important to look for what else is going on. Because if someone comes in and they have RA, which is an autoimmune form of arthritis, they have some other form of autoimmune disease, such as an autoimmune hypothyroid.
Yeah, and of course, something like RA, a lot of times that's related to digestive problems. But so can autoimmune hypothyroidism. So it might be that if this is addressed early, you're not just maybe treating one autoimmune disease, but you can be doing something to prevent another.
Absolutely. Now, the conventional medicine, as it stands for autoimmune hypothyroidism, is to just replace the hormones that are not being produced. And there's basically two ways to do this. There's the synthetic hormones, and then there is the natural hormones. So the synthetic, of course, is Synthroid, and the natural, most people have heard of Armour Thyroid.
Yeah, and there's a lot of discussion I've seen online or people comment where Synthroid doesn't work for them, so then they believe that they need a natural form of thyroid hormone. Now, is this the case that sometimes this happens? Yeah, there are those people where Synthroid really doesn't work for them, and then they get Armour or Naturopathic and they feel a lot better. However, what we're going to get into soon is that there are a lot of other people where maybe they don't really need to take the thyroid hormone to begin with, and because it's not the most perfect treatment, it's not really what their body needs, they never really feel good on it, and they're always trying to adjust the doses. The last form there I have is something called GTA from Biotics. That's more of as a side note. Because of basically a legal loophole that says thyroid glandulars are not allowed to have T4 in it. If you buy just about every thyroid glandular supplement on the market, you're not getting thyroid hormone, and it's not going to be the same. The one exception is GT from Biotics, and that's something I occasionally use with people if they come in needing thyroid hormone medication and not already on it. This is a thyroid glandular that does not have the T4 component, but is a natural T3 only. That's because the FDA said you can't put in T4, but they just forgot to include anything about T3 in glandulars. So that will work to bring up thyroid hormone as well. But if someone comes in and they're on a Synthroid or Armour or whatever, I'm not going to tell them this is better and go through the aggravation of fiddling around with doses and trying to come up with what dose of one form is equivalent to a dose of a different form. There's just no point to that. Yeah, this is more for people who maybe don't have a medical doctor. Sometimes they come and they don't want to bother, so they never got the prescription, or they just found out and it's just easier for them to get this.
Okay, so the last form of hypothyroidism is actually called functional adaptation. And that is basically when the body is under some sort of stress, whether it be physical stress or emotional stress. So that can be any sort of illness that just wears the body down, or it could be stress from work that basically wears the body down. And in this case, the thyroid is able to respond to the TSH, so it is absolutely able to make its hormone, but for some reason the body is just not stimulating the thyroid to make hormone. So in this case, the TSH is actually low rather than high, which is the usual case.
Now, what unfortunately happens is sometimes people are convinced from what they read, or perhaps certain medical doctors who decide that they're thyroid experts and that everyone needs thyroid hormone. They might give thyroid hormone in this situation, and either what happens is it doesn't work and people just feel horrible and they don't continue with it, or occasionally it may sort of work and you have someone who can go on for years constantly needing to run back to their medical doctor, getting thyroid hormone labs and readjusting this dose to try to get it work. Sometimes it becomes complicated where they're taking Synthroid or Armour, then they're adding in Cytomel, which is a synthetic form of T3. But if you go back to the labs, besides them initially having a low TSH, their antibodies were negative. So we have to respect the body and remember the TSH is your brain telling the thyroid what to do. If your brain has lowering TSH, that means the brain is saying, we don't want more thyroid hormone. So from a holistic perspective, you don't want to try to override what the brain is doing in terms of signaling and say, oh yeah, well, you say you don't want thyroid hormone, we're going to give it anyway. You want to look at what underlying issues are causing the TSH to drop, and sometimes it is issues with other hormones, especially estrogen, that can be elevated, that's often elevated in women, or just stress from cortisol, that's the major adrenal hormone.
Absolutely. What happens with cortisol is if someone is under a lot of stress, and that, like I said, that stress can be anything. That could be stress from work. It could, or stress from an illness. If someone has been sick for a long time, that body definitely sees that as stress. What it does is it will produce more and more cortisol, and cortisol basically hypes the body up. So the body doesn't want to be too hyped up. So instead of producing thyroid hormone, it will lower the thyroid to compensate for all of the cortisol. In addition to cortisol, it's important to understand that other hormones also play a role in affecting the thyroid. And those can be hormones such as estrogen during a woman's change of life during menopause, or it could just be other issues in general, such as other autoimmune diseases causing the thyroid to go underactive.
Okay, and the last thing to mention is also nutrition is a big part of this. Iodine is very relevant. There is a relationship between iodine, thyroid hormone, and a lot of women's issues because iodine is mostly used by the thyroid, breast tissue, ovaries, and that's one of the major reasons why women have so much more problems with thyroid hormone than men. But there definitely is a place for iodine and other nutrients that help thyroid function. Those are some of the things I use the most, along with working on again that hormone balance, toxicity, as any other possible stress. Sometimes the immune system. It really depends upon what's going on with each person, that case, and that's a little bit of a difference between, I think, working with a naturopathic doctor one-on-one rather than saying, oh, my thyroid hormone is low, what's the magic medication or supplement that I need for this?
Absolutely. And one last thing I'd like to mention is that thyroid medication can change over time. It's not one dose for the rest of your life. I've seen people, they've been taking the same dose of a thyroid medication for years, and suddenly it's starting to make them sick because at this point it's too much medication for them and it's never been adjusted. So that is definitely something that you want to consider when you go on thyroid support, is that you do want to get your levels tested and adjusted